My name is David Wells. Live in Fredericton, and I am a patient partner. I was one of the patient partners involved in developing these decision aids with Monica Perry. People become engaged in their own health when they face some serious health challenge. Our family journey towards patient engagement began 18 years ago when my wife contracted cancer. Well, when Solva contracted cancer in 2003, health and healthcare did become a family priority. We became engaged, me mostly as Solva's caregiver and patient advisor. She had 4 more cancer diagnoses, 2007 another mouth cancer, 2008 adenocarcinoma in her left lung, 2011 malignant mediastinal lymph node, and 2013 another lymph node in her neck. She underwent 3 surgeries, 2 sessions of radiation therapy, 3 sessions of chemotherapy, and 40 days of hyperbaric oxygen therapy. In March 2013, plaque broke loose and blocked her intestinal blood supply, and she passed away 10 days later on March 22nd, 2013. And I still miss her every day. You'll notice the quilt behind me. It's one of the 250 quilts that she made during the decade that she was suffering from cancer. That kept her alive, she thought. During this decade, I supported her becoming as informed as possible about her diagnosis and treatment. I subscribed to the Canadian Medical Association Journal, Journal of the American Medical Society. When chemotherapy was first recommended, I joined the American Society for Clinical Oncology and read about a comparison between cisplatin and carboplatin, the options that our oncologist was considering for chemotherapy. When hyperbaric oxygen treatments were recommended to halt the decay of her mandible due to chemotherapy, I joined the Underwater and Hyperbaric Medical Society and read Paul Hartch's book, The Oxygen Revolution. It's gone through 4 stages. I talked about obliviousness in your first question, and engagement to support my wife's many health challenges in your second question. So the third and fourth stages were activation to work on improvement of the healthcare system for the benefit of all, and collaboration, mainly my involvement in patient-oriented research. So my introduction to patient activation occurred in 2005 when I was asked by the New Brunswick Department of Health to chair the New Brunswick Surgical Care Network Advisory Committee. We took 6 years to implement a provincial wait time registry, and it significantly reduced wait times, although not to the established Canadian benchmarks in all cases. Collaboration began when I joined Patients for Patient Safety Canada in 2012, the Maritimes SPOR Support Unit in 2013, and Diabetes Action Canada in 2018. The first one is that clearly set out expectations from the beginning of the project so that the expectations are managed for both the patient partners and researchers. That's usually done by having the lead investigator make a welcome call to the patients in advance of the start to answer any questions and explain what's involved. The second one that I'm choosing is that the material and event spaces should be safe and accessible. Many patients will have disabilities of one kind or another, whether it's hearing or vision or physical disability, and the event spaces should be safe and accessible for them. And the material that's used should be appropriate for people that might have visual or audible disabilities.